The opposition party is boldly telling the David Granger administration that when they assumed office, they inherited what was done and what was not. General Secretary of the People's Progressive Party, Civic Clement Roy, reinforced that point after he, on behalf of the party, expressed dissatisfaction with the public information posture of the Ministry of Health in addressing the existence of the Zika virus in Guyana.
Concerns have been raised about the health sector's capacity to cope with the detection and potential spread of the virus throughout the national territory.
The party's general secretary says compounding the issue is the PPPC's belief that there are no testing facilities in Guyana for persons suspected to have contracted the virus. He stressed that Guyana had to send blood overseas for testing. This, for the PPP, is an indication of the country's lack of laboratory capacity to detect and ensure accurate clinical diagnosis and treatment for patients and to track the whereabouts of the mosquitoes that spread the virus.
It is to be recalled that a blood sample was sent to Trinidad and Tobago on January 4, 2016, and the report received from the lab in Port of Spain came 8 days after, on January 12, 2016. 2 days later, January 14, the National Assembly was informed. The government knew all along that there was a potential threat, but did absolutely nothing to protect citizens from contracting the virus.
It is to be noted that long before the detected case in Guyana in January, Roy highlighted that it was known by the Granger administration that the virus was present in the national territories of all of Guyana's neighboring countries, with 3,500 suspected cases in Brazil alone, thousands in Suriname, and large numbers in Venezuela.
This development should have alerted the government of Guyana to fear for the worst in the event of the penetration and spread of the virus in Guyana. And while pregnant women are the greatest at-risk persons, no public information whatsoever is available as to whether special detection and preventative measures are in place at both private and public antenatal clinics in Guyana to cater especially for these mothers-to-be.
The Ministry of Health's fogging exercises was also criticized by the opposition, which described the exercises as sparse and inconsistent, and that clearly no geoscientific methodology is being applied to conduct the exercises. The PPPC is also concerned about what it sees as a lack of publicity on the schedule of fogging in the electronic or print media for the information and guidance of the general public. The PPPC is recommending to the administration that they immediately request a team of PAHO WHO experts to visit Guyana soonest to assess the current state of affairs with respect to the existence of the Zika virus. And Duncan H. GP Nightly News.